Welcome to the Krista Escamilla Show.
Hello, everyone. Welcome back to the Krista Escamilla Show. I'm so glad that you're spending some time with us today. And boy, if you are about to be a parent or you are already a parent, you are in for a treat today because we have a really exciting guest here to share some important information that every parent needs to know. And before I introduce him to you, I do want to thank our sponsors because without you sponsors, we wouldn't have a show. So huge thank you to Rig ID Workwear, to Omni Midland Hotel, to Thin FR, The Preserve at Midland, the Laughlin Hotel, also to Midland Cap Company and joincapclub.com. Please support those local businesses however you can, or just support any local business, because when you do that, you know you're supporting someone's family and someone's dream. And what's better than that? It's an easy way to support someone's dream. So thank you. Thanks for supporting my dream today and being here and listening to our show. I'm so excited to introduce our guest because this is such a great topic and one near and dear to my heart, kids. And so we would like to welcome Dr. Coby Robbins, and he is with Nest Pediatrics. Dr. Robbins, thanks so much for being with us today.
Yes, thank you for having me. I appreciate it.
I forgot the most important titles. I always start with this. I don't know why I didn't. Husband and father, and he is a boy dad of 3. So
of 3, yes.
Love that. Thanks so much for being here.
Thank you. Thank you very much.
Let's start from the beginning. I always love to find out how people get to West Texas.
Okay.
Because I think it's such a lovely place, and you are choosing to raise your family here. And tell us how you got here.
Yeah, I was born here, so I just started here. Yeah.
I love that. So. It's either you're born here or you moved here for oil and gas.
Yeah, exactly.
Or moved here for some type of work, right?
Yeah.
Well, I love that. Born and raised.
I came from the earth and just spread, and I was here. So I love West Texas. So I like to travel. I like, trees and all that, but I get kind of claustrophobic in all the trees. So I really like the flatland, seeing, the horizon. So I like West Texas a lot. So I was born in Andrews, Texas.
Okay.
So I was born and raised there for 18 years, went to Andrews High School, graduated in 2006, and then came here to Midland for about a year and a half at Midland College.
Great.
And got my basics out of the way. But I always knew what I was going to do. So then I went to Tech afterwards in Lubbock for the next few years and graduated in 2010. And then after that, went on to med school at Tech in Lubbock until 2014.
Go Red Raiders.
Go Red Raiders, absolutely. And so I'm a hardcore fan. And so then I did my pediatric residency up in Lubbock for 3 more years there. And then so 2017, I finished up. Took my board exams, looked for a job, and was having a hard time finding one in Lubbock. They were pretty saturated with pediatricians at the time, and got a call from somebody down here in Midland, and obviously I'm familiar with the area, so yes. I said, that sounds great. And I still have family that lives in Andrews, so moving closer to home was great to me. So yeah.
I love that. And we were not saturated with pediatricians at the time here in Midland, right? So it was the perfect combination. I love that you said you always knew what you wanted to do, because some do and some don't, right?
Yeah.
And so how is it, like, where did you foster your love that you knew that you wanted to be a pediatrician from the start?
So when I was a baby, I had strabismus, so crossed eyes, so my eyes were kind of all over the place. And so I had surgeries. So something in that, just kind of experiencing that, I always just kind of knew, hey, I want to be a doctor someday.
Yeah.
And I think I said that from elementary school on. I never changed. So that's just always what I wanted to do. And I thought I was going to do pediatric ophthalmology. I thought I would, follow in my doctor's footsteps. But the more I got into it, the more I learned and studied, and I didn't want to focus on just the eye, but I was always going to do pediatrics. I'm just kind of a big kid at heart, so that was easy. But I didn't want to do just the eye. I was missing out on the rest of the body and
Gotcha.
health. So I decided to do general pediatrics. And when you do medicine, you find your people.
Yes.
And so, I didn't fit in with these people, and the pediatric people I fit in with, and I said, okay, this is where I belong. So
I love that. I love that you found your way, because I've heard a lot when you're in med school. That is truly where you find your niche, find which way you want to go, and you don't really know until you're in there, and you think it might be one thing, but then it ends up being another.
People change their minds. Yeah.
Yes. Well, I love that. Well, thank you for choosing to practice here in West Texas, because I don't know if you've heard, but there's a baby boom happening. There's like the largest demographic in West Texas right now is 0 to 4.
Yeah.
And so with that, I mean, I have so many questions for you, Dr. Robbins. I'm thinking, what do you wish every single person that was about to have a baby or is pregnant, what do you wish they knew before they go in? Because I have to admit, before I had 4 kids, before I held that first one in my hands, knew absolutely nothing about babies, which I think is a lot of people. So what do you wish they knew?
You know, I wish they knew 2 things. One, there's not one perfect way to do anything. So everybody thinks that, you know, you have to follow some book in a certain way. I mean, there's a perfect way to do it. There's many different ways for your kid to be raised. So, you know, as long as you love them and care about them, you're going to do fine. And the other is there's a lot of unknowns out there. And so find a good pediatrician that you can communicate well with and establish a relationship, and that way you can, you know, things that worry you, you can, you know, have relieved by your pediatrician, or things that need to be worked up can be worked up. But just have somebody that you can bounce ideas off of, because there will be questions that come up. So those would be kind of the 2 main things, I think.
And there's no dumb question, right?
No dumb question.
I think that is really important because everybody's going to have a different question. So what are some of the most common questions that you get asked, you know, that you've kind of noticed that gets asked a lot?
Yeah. There's a lot. A lot of it has to do with newborn care right after they're born, and what to do with their belly buttons after they're born. You know, so there's always all these thoughts.
That's actually a good question.
Yeah.
I kept the little umbilical cord.
Did you keep it?
I think I still have my firstborn, not my second, third, or fourth, but I think I kept the firstborn. I'm like, what are you supposed to do with this? Do you need to keep this? Should I put it in the baby book? Probably you don't need to, but I'm gonna let you're the pro. You answer these questions for me.
Yeah, a lot of people, and there's all these, you know, there's all kinds of thoughts on it, and people say, you know, you should wipe it with alcohol or do this or do that. And most of the time, you don't have to touch it at all. You just leave it alone and let it heal on its own.
Okay.
But back in the day, they used to put alcohol all over it, and it turns out sometimes it makes it kind of take longer to heal, and it's just not needed. So you kind of leave it alone.
Good
and then
one.
it falls off.
Okay.
You can throw it in the trash, or you can put it in your baby book, whatever you want to do. So, we have ours, I think. But
oh, good. I'm glad I'm not the only one. Because when I looked at the other baby books, I was like, why did I keep this? This is so random. But
it's kind of a weird thing.
It is, but you know, first one, you don't know what you're doing. You don't know what you keep everything with the first one, because you don't know any different. Okay, so that's a good question. What other questions? Because you not just take care of babies, you take all ages. So what's another
all kinds
asked question?
I mean, a lot of it's about, you know, feeding and how often a baby should eat and how often they should sleep, and you know, and again, I think what a lot of people, they think they should be on a certain schedule every 2 hours, 3 hours, and sometimes it's, hey, your newborn baby may be hungry in an hour again, they may be hungry in 4 hours, so you just kind of have to go with the flow and let them tell you when they're hungry. So yeah, feeding's a lot of things that come up.
Have you heard of Baby Wise, the Baby Wise book?
Oh yeah.
I swear by that.
Yeah.
I swear by it. It was eat, play, sleep. Eat, play, sleep. Eat, play, sleep. And it gets them sleeping through the night. And, and it worked. But if they are hungry, feed them before the 3 hours or 2 hours. Because I think it was with the first one, I was very strict, like 3 hours. That's it. You cannot eat till 3 hours. After, by baby number 4, we're like, about an hour and a half in. Yeah, sure. Let's do He's crying.
Sometimes they start out very strict. Yeah, and especially newborns and, you know, little babies. I'm like they're not on your schedule. They don't know, you know, what you want to do. So you just gonna have to go kind of do what they want to do right now. So.
Okay, let's go to that 4 to 6 year age, right? Because there's a lot of lot of people have 4 to 6 years. You have one, right?
Yeah.
So let's talk about that age. I think that is an age where it's fun. They're active. They're falling down a lot. They're breaking bones sometimes. When do you know when I should go to either ER or pediatrician?
Yeah, you know, it's hard to say unless you are able to communicate with your doctor really easily in your doctor's office, because sometimes, things don't need to go to the ER. A lot of it is, are they breathing? So are they having trouble breathing? Yes, go to the ER. That's going to be your first thing. Yes. Don't go to the pediatrician's office. Yes. And then, you know, when they bonk their head, a lot of it is they hit their head on something. Did they cry immediately? Great. If they didn't, if they lost consciousness, that might be an indicator. You might want to go to the ER. Yes. And then any kind of persistent vomiting afterwards. So those are the big things that you think about. So how your brain is working and how you're breathing. So if you're otherwise pretty content and happy and you're breathing fine and you're alert and interactive, then you're probably okay. And you go to your pediatrician's office. So.
Okay.
Yeah.
How about the F word, fever?
Oh, fever. Oh, okay.
Yes.
Yeah.
Because if you are a new parent, they get that fever, and you're like, is this? I mean, like, how emergency is this? What should I do? Or if you're like me, I'm not one that runs to the doctor a lot. If everything and I think they're fine. But how do you know? Where's that line? On fever.
That's great. I've got a whole spiel on fever.
Oh, good.
So, yeah.
Yay, I love it.
Yeah, so that's great. So, okay, so it depends on your age. So for the first month to 2 to sometimes 3 months, fevers are a little bit more important in that we have to work them up a little bit more. So if you have a newborn that's 20 days old, 28 days old, and they have a fever, and by fever, by definition, we say 100.4 or more.
Okay,
100.4.
So there's the number.
Yeah, so 100.4 or more. That is a true fever. Your body's reacting to something. We do have to do a little bit more of a workup on them. So I have to send my patients to the ER because they have to have a blood culture, urine culture, spinal tap usually for their CSF fluid to make sure their brain's not infected. It doesn't mean your baby's sick, but it means we need to rule it out before just assuming they're not.
Gotcha.
So that's kind of the most important thing. It's less, kind of 30 to 60 days, 60 to 90 days. They're not quite as big of a workup, but you want to get it worked up. So anything 100.4 or more, and if you check it by like a forehead scan or something like that, I usually say do a rectal temperature because it's a core body temperature.
Okay.
So confirm it first before wasting your time at the ER.
Gotcha.
Yeah.
Yes.
So because sometimes they can be a little inaccurate.
Nobody wants to waste their time at the ER.
No.
We're glad they're there. We're glad the ER is there. But if
they don't
you
want us to waste their time
and
either.
exactly, it goes both ways.
Yeah.
Exactly. What is it you love most about your job? I can tell you're very good at it. You're very passionate about it. What is it you love the most about it?
It's pretty easy. I mean, just watching kids grow and change over time and kind of getting to know them. So yeah, I love it. It's great. It's a wonderful job. So, and so I first started out at a private practice here in Midland, and so that was in 2018. Okay, so I started here in 2018, and it was a bigger practice. So there's a lot of pediatricians, and luckily, so some people aren't as lucky as I was. So some people work for big hospital groups or those kind of things. But I worked for a private practice owned by pediatricians. So, it was a great office to work in.
I bet.
And the doctors there were smart and always up to date on things and just did a wonderful job, cared about their patients. So that was the good part.
Yes.
And then the downside is just kind of the insurance-based model of medicine that I'll get into more in a second.
Yeah.
That really led me to open my own practice to try something different, to kind of get away from that, especially after COVID occurred. So I mean, we were kind of booming during COVID, and there's a lot going on. And,
right.
But yeah, after COVID, I mean, a lot of things changed. Obviously, healthcare kind of changed a lot. How people utilize it, and then insurance has just kind of been all over the place. So I'll go over that too here in a second.
Yeah, because I'd love to know the difference between your new one and say old school, because us that are not in that realm don't know about it. Although I have some doctor friends, so I've heard little murmurs. I just don't understand it. What it means.
Absolutely. Yeah, most people don't understand insurance. I hardly understood insurance until I started working more in it. So when you're a resident, you don't really deal with the billing and stuff. You're learning medicine. Yeah. And then you get out and you're working, and then you learn about billing and how to do those things. So how to get paid for your work and get everybody else paid. So that's kind of how I kind of started learning about it. The practice that I was at was great, and I loved my job and loved all my patients. Everything was good, but I was seeing many a day, which is not uncommon. A lot of people, see a lot of patients a day, but it just becomes a little unfulfilling. You feel like you're just kind of rushing people through as fast as you can. You're seeing 20 to 30 people a day, and and some people see 30 or 40 people a day, and and some people can do that. And I think that's the main thing is all the people I've ever worked with, they want to do what's best for their patients. It's just hard to in the constraints of that kind of model. Right. And so you have to see that many people to kind of keep things moving and keep the lights on, and kind of make sure everybody is doing well. So this is what's called we'll just call it the insurance model of healthcare, of primary care. Okay, so in your insurance model, you have your health insurance that you pay your premium for, and your premium is just so you have the insurance, okay? And then you go see your doctor, and you usually have a copay of some kind, right? And so you pay your copay, and that depends on what type of insurance you have. So every time you go see your doctor, you're gonna have your copay, and then it depends, if you have like a certain plans, like if you have a well check, you don't have a copay for that, because they promote well checks. Yes. And then there's things on top of that. So if we happen to do any lab work in the office, or if we do testing, or different kind of surveys, things that ask a bunch of questions that we have to review and it takes some time, then that'll be billed as well. And most of the time, insurance isn't going to cover that.
Yeah.
So
and that's why you get a bill after the fact sometimes.
Exactly.
When you walk out the door and they say, "Oh no, you're good. You've already paid here," and then you get home and then there's like a lab bill. And
a
you're
month
like,
later, you get
wait, I thought okay, so that explains that. Those are two separate entities.
Yeah. So because you don't do that until you're done. So then you bill for it all. You've already paid your part. So, and a lot of people think, well, my insurance will just cover it, but they're only going to cover certain things. The rest they're going to leave up to you, and obviously you're going to pay up to your deductible before they start covering a lot of things. And so your deductible can be, $3,000 or $10,000, depends on the plan.
But you're out of pocket until you reach that number.
Till you get to that number, yeah. Okay. Yeah, so I remember our insurance changed, within the past few years while we were at the office. So we brought our kids to the doctor, and they were seen. And they did a strep test and a flu test, and we did whatever. And then we got a bill in the mail for our strep and flu test, and I was like, I thought our insurance covered this,
right?
But,
which is pretty common. I mean, we've all been there, right? You get that other bill, and you're like, wait a minute, what? So it does not always cover all those things.
Yeah, sometimes I think they used to more than they do now. So
that's what it seems like.
Yeah, it does. It just seems like it was changing a lot, because I thought they would just cover it, but they do not. So
they don't.
and then. So then you have to pay for that. So, I think we got like a $20 strep bill and a $30 flu bill or something like that. So not crazy, and that's just what it charged. So that's kind of how the insurance model works. Okay. And how it works on our end. So you see it from the patient side, right?
Right.
And then on the physician side, on the clinic side, so we have a certain code that we use to bill for a visit. We send that code to your insurance and say, this is what we did today, this is how much time we spent with you, and this is what we charge for it. Mm-hmm. And so let's just use numbers. So okay, we did this visit, and we think it's $150 worth of time, and this is what we did. And so they'll say, okay, so your patient paid their copay of $20, and we'll pay you $85.
Are they just making that number up?
Yeah, there's contracts that you sign, but it varies a lot. Yeah, and so they have a number that they do, but each clinic and each kind of medical entity can have a contract signed with these insurance companies, and so then they decide how much they're going to pay you. And I've seen some that come back with like $5, and you're like, and you have to go run, after the insurance company, like, what? Why are you only paying us $5 for this visit? That's
why I was wondering, like, how do they come up with these numbers?
Yeah.
So it has made medicine a little more complicated, than it used to be.
It has.
Where it used to be, it seemed like it was just, if it was under your insurance, it was covered, and boom, and there you go.
Yeah. Okay. It's gotten more and more complicated. Yes. So that's kind of how it looks on the doctor's office's side. So that strep and that flu test, that's the same thing. So the strep test, we charged it to the insurance company, and we said, okay, we think this is worth $30, and the insurance company said, well, we only think it's worth $15. And the patient's going to pay it, and then it gets sent to you. It's very odd. It
is so strange. Like, what gets covered and what doesn't? Sometimes I think, oh, this isn't getting covered, and I walk out. They're like, no, you don't know anything. I'm like, really?
Yeah, thank goodness.
Okay. And then other times, you just never know.
Yeah.
So from your standpoint, now that you're in Nest Pediatrics, how does it work? Are you a concierge? Is that how you work, where your patients then pay a concierge for an annual fee?
Yes, sort of.
Okay.
So part of what I'm trying to do is kind of educate the area on something called direct primary care, DPC. Okay.
DPC.
So DPC. So that's kind of what I wanted people to take from this and kind of learn a little bit about. So direct primary care is a new model, somewhat new, within the past 5-10 years. It's been kind of cropping up. A lot of family medicine doctors do it. But the main problem, so direct primary care. So the main problem with insurance, we could go into it.
This could be a 2-hour podcast on just insurance. I'm sure it could be.
It could.
Yeah, there's so much entailed in it. But
yeah.
Wow.
So, specialists, like insurance understands procedures. They understand what a procedure is and how to bill for it, but they don't know how to bill for primary care. Primary care is different. So primary care, we just spend a lot of time with you, answer a lot of questions, and we answer things outside of office hours and outside of office visits, and you're not going to get paid for that because you have to be in the office and get, So a lot of times if your doctor calls you and asks you back to come do lab work, why can't you just tell me over the phone or just tell me?
Right.
They may want to go over it with you in more detail, but they can't get paid unless you come in and see them.
Gotcha.
Yeah. So, that's not what, a lot of times doctors bring you in because they want to see you again and they want to go over it with you in person.
Right.
And they don't have time to call everybody.
To do it. Yeah.
Yeah. So they bring you in.
Okay.
So direct primary care is this kind of new model, and basically, so it's like concierge in that you do have like a monthly membership.
Okay.
So you have a monthly membership that you pay, and that monthly membership, just like in concierge, gets you in the practice, and that helps the doctor have less patients and more time for you. Right.
Yeah, I was going to say, to me, DPC equals more quality care.
Yes.
In the long run, for patient, for doctor, for everyone.
Yes.
Okay.
Yeah. So you get access that way. Some of it's convenience. So some of it you're going to have more convenience, but a lot of it is access and relationship based.
Yes.
So the difference
is what you want, right? That's what you want with your pediatrician. You want that relationship built through the years.
Yeah. I mean, sometimes, if you have a specialist that you see once every couple of years, you don't care.
Right. It's like,
you see them, you get a surgery done, as long as they're otherwise somewhat nice, you're fine. You don't care. But for your primary care doctor, you want to have a good relationship with them and kind of build trust over time. And so in insurance-driven care just doesn't allow for that.
Gotcha.
It allows for 10-minute sick appointments and 20-minute well checks, and you're in and out, and we got to see somebody else. So this model is going to limit my number of patients and allow me to provide better care and more time for all my patients.
I love that.
So what's different between this model, direct primary care, and concierge is they're still going to use your insurance. So they're still going to bill insurance, but that concierge fee allows them to have fewer people in their practice so that you have better access to care. Okay. So concierge is great. It still gives you that, that better access to care, and typically you're going to, have better experience.
Right.
But you're still going to use your insurance to bill for visits and those kind of things.
Gotcha. So with DPC, you don't use your insurance?
Right. Okay. So DPC, direct primary care, your monthly membership covers all your visits. And one thing about DPC, it's doctor dependent. So I can structure it however I want to. So the way I structured mine is you have your monthly membership, and that's going to cover all visits, well checks, sick visits, unlimited. There's no limit to the number that you're going to have. Okay. And then when you come in for a sick visit, there's no copay. There's nothing like that. It's just part of
It's just
the
part
visit.
of your membership. I love it.
And it also covers in-house labs like strep, flu, anything that I do in-house, hemoglobin testing. I just included that. So some offices will charge for that extra on top of your membership, but it just depends on the direct care doctor what they want to do.
Right.
So I wanted mine to be pretty simple.
Yeah. And
kind of be able to do that. So that's what separates the two. So DPC, direct primary care, is like concierge, just
a little
the next level.
Next level.
Even more direct care. My patients have direct access to me to text me, so they can text me any questions that they have,
which every parent wants, right? I mean, I know you're all shaking your head at home because, I mean, how often do you think, I wish I could just text my pediatrician and ask them if this is normal, if this is something they need to look at, or do I just need to rub some dirt on it and put a Band-Aid on it? That's a joke in our house. It's like, just rub some dirt on it.
Rub some dirt, it'll be fine.
Rub some dirt, you'll be fine. So that's amazing. And I know a lot of you have a lot of questions. You're probably Googling DPC right now. But of course, if you have any questions, you can call the office and you could answer them further on if this is a good fit. And that's the most important question I was going to ask next is, are you taking new patients?
Yes, so I am still taking new patients. So I opened up in January.
Okay.
So opened in January. My goal is to get to about 350 to 400 patients. And a typical pediatrician is going to be somewhere 2,000 or more patients. And that's just the number you have to keep people coming in the door. So I'm about halfway there right now to my goal.
Congratulations.
Well, thank you.
Yeah,
thank you very much.
That's great.
Thanks. It's been, I think a lot of it helped that I was already practicing in the community, so people knew me. And I think a lot of it's just getting the word out. Some people just don't know where I am or what this is.
By the way, that's 3000 North Garfield.
Come find me.
That's where you can find him.
And the practice number you can call. You can also just text the number and say, hey, we're interested. Can you give me a call? And we'll call you back. So this sort of model, so I'm the first direct primary care pediatrician, so direct in the area that I know of. If you know of one, let me know. But I don't know of another one. So I'm the first office in town doing this. There might be some family medicine doctors, and this is another thing that I kind of wanted to get the word out for doctors as well, because some family medicine doctors or pediatricians may feel kind of burnt out and just feel like they're not contributing and feeling like they want to quit, and because that is a problem in medicine. A lot of doctors are just like, okay, I'm done. With this whole rigor.
I mean, because it is. I mean, I feel like I'm not a doctor. I feel like I am when I Google, which is a whole nother story. But I would imagine it's hard to shut it off at night, and you're seeing so many people during the day. You probably carry those patients with you. You're thinking about them all the time. So they do get burnt out. Burnout, I would think, is pretty common.
They get burnt out, and they work, and they see 30 people a day, but there's all these phone calls they have to answer and all these portal messages that people have, and they want to do their best care, but it's just very hard to do that. So I wanted to kind of get the word out to other doctors in town, like, hey, maybe if you're thinking about something different, maybe look into DPC and consider doing this. And it is.
I love that you're sharing what's working for you, and would be willing to talk to others about it. Yeah, because that's fantastic.
Yeah, absolutely. It's great. It's been great for me and my family. I mean, it's a lot of work, but I think most of us don't mind working. We just want our work to mean something and to be effective. And so in this model, every day, even if it's a hard day and I'm seeing a lot of people with a lot of issues, like I feel good at the end of the day because I've solved some problems.
That's great.
With this model, with your pediatrician, it's hard to go to your doctor and you see them for a well check. And you go home and you're like, oh, I forgot to ask about this.
Which happens every visit, right?
And how are
every visit, you get home, you go, oh, that one thing I forgot.
And how are you going to talk to him again? Well,
so they can text you.
They can text me, You don't have to schedule an appointment or go through a few people to do that. So that's that's a good benefit of this practice. So.
I love that. Well, thank you for sharing that with us, Dr. Robbins. We're going to take a quick little break. We do something fun here. Okay. I think it's fun. Hopefully you will too. It's called Quote of the Day because I love quotes. And so we're sitting here today in Midland, Texas with Dr. Coby Robbins. He is the owner of Nest Pediatrics, and we're talking all things pediatrics, insurance. I'm going to ask some of those questions you're thinking of right now in a minute, but first we're going to take a break for Quote of the Day. So you pick one out and then you read the back and you tell me what that quote means to you.
Okay.
What card did you get?
I got
the kind card, because yes, you were so kind. I love that.
That's okay.
Okay, what is yours?
Okay, to handle yourself, use your head. To handle others, use your heart. Eleanor Roosevelt.
That's a good one for you. What does that mean to you?
Yeah, so I mean, I think in my line of work, I think. In medicine in general, sometimes people can get a little hard-hearted and not enjoy questions from people. And in my line of work, I have to, take every question, just like you said. There's no stupid question. There's no
stupid question.
Like I always tell people, like any little thing you have questions about, like, just because I think it's easy and doesn't bother me doesn't mean it doesn't bother you. So I'm going to try to treat everybody, with kindness and understand from, their perspective what their concerns are. Yeah. So, I think that's a good quote. So,
do you have a quote that you live by?
Not that I live by, I don't think. I had watched a couple of your podcasts. I know you'd asked some people about.
I'm a big quote girl.
Quotes. Yeah,
I learn from everybody's quote. I learn from everyone that sits here. I'm learning today. I love it. So.
Yeah, it's a lot of fun.
It is fun. It is.
I wouldn't say I live by this. I just find it kind of interesting. So, one of my favorite quotes and thoughts is from Ecclesiastes.
Yeah.
So, there's nothing new under the sun. So what has been will be again. What has been done will be done again. So I just think sometimes as humans we kind of think we're pretty clever and smart, and we outthink things, but we're all just kind of repeating things over and over again.
It's true.
So kind of like my practice, my DPC practice, it's kind of a reversion back to old times when you had your doctor and you had that close care, and so my idea of direct primary care isn't that new. It's kind of an old idea that we're bringing back. So
I love that, but you're bringing it around with a new spin on it.
Yeah, with a new spin.
And so, so speaking of, we're going to transition a little bit into some questions that maybe people listening are thinking of. That,
okay.
And I think there's so many different ones, but I want to start with maybe vaccines.
Okay.
So like vaccines, I'm sure you get asked about vaccines all the time.
Yeah.
And so what are some myths about vaccines maybe that you would like to go, oh, you know what? Let's clear this up today. Yeah.
Krista, are you ready for this conversation?
I am ready. I don't know. After seeing his eyes go that big, I'm like, wait a minute. Kind I just open a can of worms?
Yeah, I don't think you're ready for this. No, this is a hot topic will get some kind of conversation started for sure. So my practice, there's a lot of talks on vaccines. So in my practice, I don't require vaccines. I definitely recommend them, and I am pro-vaccine, and I will educate my patients on all the different kind of vaccines that there are and what is recommended at each age. But I don't require them to get vaccines because I know there's a lot of information out there and a lot of concerns that people have.
Right.
So that being said, my opinion and my research on this, and I've been looking at vaccines and everything since residency during pediatrics, because this is always a hot topic.
Right.
So I think a lot of it is, it's kind of fear of the unknown,
Right.
So there's a lot of, do vaccines cause autism? And they have done numerous studies. It does not.
Okay.
Now, so what does cause autism? And we just don't know exactly. I think, and it's that fear of the unknown, and people want to blame something. And so sometimes vaccines get the blame.
But we still don't know. We don't know if it's genetics. We don't know if
It's probably genetics. I mean, that's kind of the most, a lot of times they link it to different things within, chromosome, but so it's probably genetics more than anything else, and not anything that you can prevent or control. It's just something that happens. So
Gotcha.
So that's kind of one of the big ones, is does it cause autism or anything? And
what's the upside?
Upside to vaccines. Lots of upsides to vaccines, So lots of avoidance of unnecessary illnesses. So, and some that I don't see. So like Haemophilus influenza B is a bacteria that causes terrible meningitis. And it killed many children and caused lots of limb loss and all kinds of different things, a lot of morbidities. And but I don't see it. I've never seen it because of vaccines.
Okay.
Polio. You've seen all the movies of people, and I think a woman just died recently. She was the last woman in the iron lung, and she just died recently. She had polio, but we don't see polio because of vaccines. Gotcha. So there are many benefits, and I've never seen myself a patient that's ever had any kind of reaction to a vaccine, besides your regular local reaction, that sort of thing. So a local reaction, redness, it's what it's supposed to do. Your body's fighting something and it mounts an immune response. So that's a normal thing.
Right. Might feel a little ill.
Yeah.
Maybe maybe just need to take a little Tylenol or whatever you prescribe. Not me. I'm not the doctor. But
No medical advice is given.
No medical advice being given here. But whatever is, you tell them how to treat the reaction, then they do that.
And they do that. So I've given and seen thousands of vaccines, and in my practice now, so it used to be the nurse would give vaccines. In my practice, I'm small, I give them myself.
Oh, good.
And so I'm kind of getting to see it firsthand, and everybody's done well.
Right.
And so that, and there's a lot of concerns about things in vaccines. Aluminum's always going to come up. Okay. Why is there aluminum in vaccines? And a lot of it has to do with how the body's immune response works. You're trying to help it to work better. And there is aluminum in vaccines, and it is a tiny amount, and it's less than what you get in breast milk feeding your baby. So again, it's fear of the unknown.
Yes.
And there's a lot of fear out there, and a lot of different medical advice and doctors. And so my best advice would be to get you a doctor or pediatrician you can talk to.
Right, and ask these questions.
Yeah, and if in the end they say, well, I'm still worried about it and I don't want to get it, then I'm okay with that. I just try my best to educate and let them know why I think it's a good idea.
Great. Next topic, technology, because I think technology is one that I'm sure you your age, you have seen technology most of your life, but you've also seen it evolve and change, where every 2-year-old now has a handheld device or an iPad. So what is your pediatrician advice to parents when it comes to technology? And then your parental one, it might be the same. I'm thinking it might.
Parental's probably different, than pediatrician advice. Pediatrician, got to stay off the screens. And, screen time obviously is not great for your brain if you're just stuck on something all the time. But as a parent, you need them to be able to do something while you get something done. I mean, kids are sometimes needy. So sometimes you need to fold some laundry.
Yes.
And they're not going to let you unless they're doing something. So I think the best thing to do with technology is just be aware of it, just be aware of how much you're watching and set limits that whatever you think is best for your family. There used to be like a 2-hour, they always said 2 hours that should limit screen time to, but whatever you think is best for your family and stick to it, and your kids are going to scream and cry when you take them off, and that's okay. Just say, okay, that's all for today.
Okay.
They're going to be okay, that you'll be fine. Our kids are the same, they want to be on the iPad, and we said, no, come off and go play, and they don't want to play with the 100 toys that are in the room.
Oh, have you seen Toy Story 5?
Yes.
Oh, it's the best movie. But when you said go out and play, it made me think of that. The art of play. I think that is something that needs to be encouraged. And maybe you do in your practice, but get out and play and be active.
Yeah.
Right? And technology is nothing new. I mean, I am not going to sit here and say I didn't watch a screen my whole life. I mean, I watched a TV, right? Like for our generation, we grew up, we didn't have phones, but we had a television that mom could put us in front of, right? If she wanted to get stuff done. So it's just now that it's evolved so much that it's now going with us, right?
Yeah,
where before it was just always at the home. Now it's traveling in the car. Now it's at ball games. When you should be watching the ball game, you might be watching your screen.
Yeah, which is sad to see. Just like the movie. It's sad to see kids. And I think it hurts communication as well, in kids if they're not looking up at somebody and looking at them in the eyes and communicating. I think it can hurt them in that way too.
Yes.
So just be aware, set limits for your family, and stick with them. And when your kid throws a fit, just know that's okay. That's fine. They're going to throw a fit and they'll be okay. So,
what point do you feel like parents, a lot of times with parents, you think something might be happening with my child, not quite sure. When should they go to see a doctor, whether it's for physical or for mental health? When should they take that next step?
I mean, honestly, anytime you have that concern, I think it's a good idea, especially if it's mental health. I mean, I think you should get it checked out. If it's bothering you enough to consider it, I probably would go in. Yeah. And it can be as simple as just kind of an initial, hey, let's talk about this, and just know that we're all aware of it, and then maybe treat it down the road if we have to. Yeah. But just kind of get some ideas. But yeah, really any kind of time you have a concern that's coming up that is bothering you enough, then I think it's worth getting it checked out. One thing I forgot to finish my spiel on Fevers.
Okay, good. Let's go back to
Fevers.
fevers.
Yes.
He loves fevers, doesn't he?
We're gonna go back to fevers.
He's got his fever spiel.
I have to get this out.
No, that's good because every kid is going to have a fever at some point.
So if your kid has a fever, so I talked about the first 3 months. After that, so let's say 4 months and on, so they have a fever, 100.4 or more. So what? Because I believe you asked kind of what's the number that's concerning.
Right.
When is it concerning? So fevers in children are a little bit different. From our standpoint, and again, to you as a parent, it may be concerning. Mm-hmm. So please reach out to me. I don't care. Yeah. But for me, fevers aren't as concerning. So most pediatricians and specifically pediatrics, we're really trying to get the word out. Fevers aren't a bad thing. So fevers are your body responding to something, an infection. Most of the time an infection. Sometimes it's something different, something autoimmune, but a lot of times it's an infection and it's doing its job.
It's like a red light going, hey, something's not right here.
Yeah, something's
just warning,
not right.
Warning.
And it's part of your body's system. So your body's kind of amping up to fight something. So so you don't have to treat a fever. You don't have to keep a fever down. Some people do everything they can. They throw their kid in a tepid bath and do all these things. You don't.
We put Vicks on their feet.
Yeah.
And
we gotta get that fever down.
Right, sweetie? We put Vicks on their feet. We rub their chest with Vicks.
Whatever it takes.
Whatever it takes to get that fever down.
And my main.
What was that?
Every culture treats fevers differently.
That's true.
They
That's
do.
true. Yes.
Yeah. So different kind of cultures have on different thoughts on fever, and I think my main kind of point to parents is, you're treating your kid for their comfort. You're not treating the fever to fix anything necessarily. You're mostly keeping them comfortable.
Okay.
So if your kid's comfortable and they're at 102 fever in the middle of the night and they're sleeping, you don't have to wake them up and treat it necessarily.
Okay.
But you can if they're uncomfortable with the fever. So you're treating them for comfort. So if some people put them in like a bath of water, colder bath or something, and
so you're saying
if it makes them uncomfortable, I wouldn't do it. Yeah, because you don't
no cold baths.
You don't have to bring that fever down. The fever will come down when it's ready.
Yes.
And your Tylenol and your Motrin may help bring it down some, but even then it may not all the way come all the way down.
Right.
So it's okay. Treat the fever if it makes them comfortable. It'll help them to drink better. And when I have a fever, I take Advil and Tylenol because I want to feel better.
Right.
But it's not a big concern.
Okay.
However,
yes.
Talk to your doctor if you're concerned about it, and call me if you're my patient and you have a fever and you want to know more about it.
But usually 99.5 is not something to worry too much about.
That is not a fever.
Okay. Just wanted to clarify that.
Yeah, that is so think about it as
because there are times when when you're a new mom, you don't know. You're like, oh, it's not 98.6.
Yeah,
this
exactly.
is a fever. This is a fever. So that is not concerning.
Yeah, think of your body temperature as a range more than just 98.6. Yeah. Anytime it gets to 99, people start thinking fever. I mean, it's got to get to 100 before you even start thinking that.
Okay.
And even then, sometimes it's just within your normal body temperature range.
Right.
So anything up to
might be summer.
it
might be summer and you're hot, like right now. It's hot outside.
Yeah, it's hot.
Yes.
Yeah, I was 100 degrees earlier today.
Yes.
So that's the main thing is that don't be afraid of fevers.
Okay.
Fevers are okay. That's your kid's body fighting something. Treat it if they're uncomfortable, but you don't have to do everything in your power to decrease the fever. It's not an emergency.
Perfect.
So, okay.
Any other myths that you want to? I love though that you have the fever spiel. I love it. I love it. Any other myths you want to debunk about medicine, or not even debunk, but really just encourage for parents to feel? I think the part about being a parent is, we feel helpless sometimes if our child is sick or if our child is hurt. So anything that we could maybe help a parent today feel a little better about the health of their child, because that's what all we want is our child to be healthy.
Yes. So I think a lot of it is everybody, that's my experience with families is, parents, they don't bother me at all when they're concerned about something. And they will, some people. I mean, some people get bothered by, a parent always worried about something. But I know that what the parent is wanting is they're wanting their kid to be okay.
Yes.
And that's what they care about. And so my main thing is, just know that most doctors, most, of us in this field, we do care. We really do care. We want what's best for your kid. It may not always match up with what you want done for your kid sometimes. we'll go on to colds. So
Okay.
viral colds.
Good.
So children get
Next topic, colds.
Next
Okay.
topic, yes. Next hot topic is colds
Yes.
and antibiotic
I
usage.
love it.
So
Oh, good one. Yes, we didn't even talk antibiotics.
yeah,
Yes.
yeah. So
Yes.
we're gonna hit them all today.
We're hitting them all.
So a cold is caused by a virus. So sometimes it's flu virus, sometimes it's coronavirus, sometimes it's just any other cold that you have out there. So colds are viruses, so they don't respond to antibiotics.
Okay.
In pediatrics, we're sticklers on this. I mean, we're kind of annoying about it, but for a good reason. Where we don't want your kid to have antibiotics if they don't have to have it, because antibiotics mess up your gut. They're not great for you, and if we use it in every single kid, there's going to become some antibiotic resistant bugs that we don't want.
Okay.
So we
That's
don't
why
treat-
you're not getting it all the time if your child is sick. Because I think that's
Yeah.
the frustrating part as a parent. You think, no, my child is sick.
Yeah.
Why are they not getting an antibiotic? So how do you know if it's a virus or not?
So just based on the symptoms and what you're seeing. So if it's a cold, if it's a viral symptom, then we're going to treat it like a virus. And so in viruses, nothing to do for it, but just kind of symptomatic care.
Okay.
So keep them hydrated and breathing humidified air, kind of moving things through. But antibiotics come in when there's a bacterial infection somewhere. So so ear infections. So sometimes your cold turns into an ear infection. Then you'll get antibiotics. A lot of time, and I don't want to put anybody down, but a lot of times it's a lot of adult medicine problem where there's a lot of urgent cares. They go to urgent care. Urgent care gets to see them one time.
Yes.
So it's not always the urgent care doctor's fault. Sometimes it is, but sometimes it's not. They get to see you one time. They don't know how you're going to do. And so they just, we'll just put you on this antibiotic because you've got a bad cough. You got a bad kind of chest cold or something. So we're going to put you on this antibiotic and the steroid and you go home. And then parents come to the pediatrician's office and we don't give them anything like that.
Right.
And there's a good reason for it. And that's because we're watching your kid, and we know what looks like a bacterial illness and when it doesn't.
Yeah.
And if it does, we'll treat with antibiotics. If not, we're not going to, because it's not good for your kid and it's not good for society to use that many antibiotics, because sooner or later they stop working.
Yes.
And that's what we're trying to prevent. So on an individual level, it's not good for your kid unless they need it. And then on a global level, it's not good because they'll stop working. So.
Yes. Well, hopefully that will help clear it up a little bit,
It's all
because it can be
clear.
frustrating. Speaking of clear, is it true if you have green boogers that you have a bacteria infection or not?
Great question.
Okay,
Yeah,
good.
love it.
Whew.
Yeah.
Well, that was a good one.
Yeah, that's a great one.
When you said clear, I was like, well, sometimes the snot's clear, sometimes it's not.
So, yeah.
What does that mean? What do green boogers mean?
Green boogers do not mean bacterial sinus infection or anything like that.
Not yellow either?
Not yellow either.
Okay.
Sometimes white, bloody, that may be a sinus infection, but
Okay.
but big, thick, nasty green stuff coming out of your nose does not equal bacterial infection. It can mean just a bad cold. So it just
Good to
depends
know.
on how long it sits there and how much your body kind of takes in some fluid from it. It just becomes thicker. So
Good to know,
but yeah,
good
so
to know.
definitely green boogers don't equal. This is questions I get so I love this. Questions I get all the time. So definitely doesn't equal you need antibiotics. So in my practice and in most is we try to follow like a rule of how long does a cold usually last? 7 to 10 days.
Okay.
You should be showing some signs of improvement. And that's longer than most people want to wait. 4 or 5
Right.
days, they're
Well,
over it.
We live in an instant society where we
Yeah.
want everything fixed at our fingertips, right?
Yes.
Yes, that makes sense.
Absolutely,
7 to 10 days. That's
7 to 10 days. And after
that's
10
a lot of
days,
patience. I mean, not patience, your patience, but like
Yeah.
patience for inner patience. Inner patience if you have a cold to wait 7 to 10 days.
Yeah.
So how do you treat just the normal over-the-counter cold medicine stuff?
yeah, for adults,
Okay.
older kids. I mean, in pediatrics, we don't recommend a lot of cold medicines. The side effects are more severe than any
Okay.
of the benefit you get from them. So we try to avoid a lot of cold medicines. And just in my personal experience, I have a cold, I take medicine, nothing helps. I mean, it's just these medicines,
Yeah,
a lot
it's
of them
true.
don't help. If you have like Sudafed as a sponsor, I'll stop talking. But no.
I don't, but hey, if you want to sponsor us, Sudafed, give us a call.
Yeah, I won't degrade them anymore. But I mean, so sometimes I'll recommend, Sudafed kind of decreases a little bit of the congestion in your nose. Cough medicines, like anti-cough medicines, I mean,
Mucinex.
Mucinex is okay. I mean, I'll recommend that some, but that's an expectorant, so it kind of helps you cough up some of that stuff easier. But again, I would say side effect wise, like there's not many side effects to Mucinex, and benefit wise, there's a little bit. So I
Okay.
usually recommend that one for the real young ones because there's not a lot of side effects to it.
Okay.
And then the cough medicine, like true, guaifenesin kind of cough medicine, I try to avoid that one because it just kind of it causes a lot of issues neurologically and just kind of makes you feel yucky sometimes. So we try to avoid that in little ones. I tried it myself when I was really sick. Took my Delsum and couldn't tell a difference an hour later. So I don't think they're that helpful, but we'll try to guide you best we can.
What like if you were to give advice to a new parent, this is what you need in your medicine cabinet.
Oh, okay.
What things should they have in their medicine cabinet? Because
Yeah.
some will buy everything, some
Yeah.
will buy nothing, right?
Yeah.
And so what do you really need?
So for newborns, so part of my practice is, which is kind of fun, is I do newborn home visits. So
that is good.
after they're born, I'll go to their home and see them. So that's a lot of fun.
That is fun.
If they want me to come by their house, that way, because I know how it is after you've had a new baby, you're exhausted.
You don't want to get
out. Yeah, don't want to go wait at the doctor's office for hours. So I do that. So we'll talk about some of these things, but big ones. I mean, there's not much really. For newborns, it's a rectal thermometer. Most people don't have that, and they're kind of worried about it. But read about it a little bit.
Yeah,
Learn about it.
they're good to have.
That way, if you use your ear, checker, you use your forehead scanner, and it has a fever, confirm it rectally.
Good idea.
That helps the doctors at the ER if you do have a fever. So, so that's a big one. For kind of up to 6 months, Tylenol. So again, your baby's teething or whatever, you've tried everything else under the sun, maybe they just don't feel well and they just need a little Tylenol to get through a few days. But 6 months and on, I like ibuprofen, Advil, Motrin. Motrin, that's what I like. I like it myself. So that's my staple in my cabinet.
Yes.
Makes me feel better. So I think that helps a lot.
Band-Aids.
Band-Aids, have some Band-Aids.
When they're toddlers.
Sometimes they need them, sometimes they don't. They just like to have them.
Yes.
They're just fun to use sometimes. But Advil for sure, because sometimes your kids they have a cold or some sort of virus, but they have no symptoms. They just are achy and they can't tell you. They just don't feel well. Yeah. And so sometimes just giving them a dose of Advil and hey, they finally got some rest. So
what about Benadryl? What are your thoughts on Benadryl?
Oh, Benadryl. So Benadryl.
I feel like we always had Benadryl in our house, and now I just was cleaning out my medicine cabinet, and there was like this little lone bottle that had been there for years that has not been touched. Yeah. Because the kids are big now, and I was just like, do I still need this? Do I throw it away? So anyway, Benadryl. What are your thoughts on Benadryl?
I mean, it's a good medicine. We use it all the time for things. It has a lot of side effects to it. So if you can, for your seasonal allergies, and typically in the older kids that start getting allergies when they're 2 to 6 or something. Zyrtec, Claritin, Allegra, those have less side effects. Okay. So I typically stick to those. But it's good to have Benadryl around in case you have more of a severe reaction that needs something quicker. Yeah. Just know it's going to make you sleepy and drowsy and a little out of it. Yeah. And sometimes it does the opposit. It makes kids a little crazy. So
I've heard that too. Yeah. It does have the opposite effect. So. You said something earlier. You mentioned my favorite word. Okay. Hydration. You are on fevers. I have a whole spiel on hydration. I feel like the world is dehydrated. Yeah. No one's drinking enough water. So how do you know if your child is dehydrated?
A lot of it is urine output, how often you are going to the bathroom. That's the easiest way to know. Yeah. And I think a lot of us are just kind of chronically dehydrated. Yeah. I'm probably dehydrated all the time. So I try to stay on top of it, but I also like Dr. Peppers a lot. So that's my drink of choice.
Which will dehydrate you, right? A little, I mean, sodas, and this is not, if you drink soda, coffee, tea, those are going to dehydrate you, right? Isn't there like you have to 1 for 1? If you're drinking one, drink a glass of water or something like that?
Yeah, you should.
Yeah, you should, but not all of us do, right? I mean, we're all guilty of it, right?
Yeah, absolutely.
But I think it's important. I did not. I guess I feel like as I got older, I learned the lesson of like how important water is, and I don't think I ever gave my baby a bottle of water. So this might be a dumb question. This might not. I don't know, but I don't have babies anymore. But should you give your baby some water? Just like say, here's some water.
It's not a dumb question at all. It's a really good question.
Oh, good. Whew.
Yeah, that's a good question.
See, I said there were no dumb questions, but I thought, well, this might be. I don't know.
So you don't give them any water until about 6 to 9 months of age.
Okay.
They don't need it. They're getting it all in their breast milk or formula, so they don't need
Perfect.
they don't need water. And free water by itself in an infant isn't good for them. Their
Okay.
kidneys don't tolerate it well. It can cause sodium problems. So
Good to
don't give
know.
your baby under 6 months free water.
Good to know.
Yes.
Good to know.
Yes. Don't do that unless you're in the hospital and they're watching or something. But then after that, it kind of becomes a gradual thing, just like food. So when you're giving food at first, you're giving small amounts. They're practicing with it. Same with water. Okay. So I usually tell my patients about 6 months on, you can give them a cup of water and let them play with it and take a few sips here and there. And then by the time they get to 9 months to 12 months, they're eating more, and then their water intake is going to increase more and more as maybe they drop off some nursing sessions or they're not taking as much formula. So
Okay, parenting advice for the parent that is dealing with grandparents, telling them, this is the way we did it. How can you give some great words to those parents that maybe are in that in-between stage, right? Where they've got the grandparents telling them, maybe they're new parents, right? They're newbies.
Yeah.
But they also are listening to their pediatricians and taking on this great advice you're giving.
Yeah.
How can they handle the grandparents' old school advice?
Oh, yeah. Old school advice. I think first off, respect your parents because they were around a long
Good
time
answer,
before you.
Dr. Robbins.
Yes,
Good
thank you.
answer. I really like that because I'm going to be a grandparent someday.
Yeah, right.
So good answer.
And all their advice may not be for you or exactly what you want to do for your kid, and that's okay. But still be respectful and understand where they're coming from, and that they're trying to give you some good advice on what helped them and what they remember from it. And so I think it's a good idea to listen to them. And then if something doesn't seem right, and you're like, I don't know if I should be doing that, and you talk to your pediatrician and they say, no, it's okay, you don't have to do that, then it's okay, and you just you can do it when your parents are around, and then when they go home, then you don't have to do it anymore. So.
Because that's what the grandparents are doing also when you're not around. You're not around, they're not following that schedule that you laid out for them. Yeah, they're like, hey, parents are on a date weekend. We got this baby. We're doing it our way anyway this weekend.
Yeah, they're going to do it their way. Exactly.
So that was a very good political, correct answer to handle the situation.
Yeah.
I love it.
Yeah,
I love it.
My office, I get moms in and dads and sometimes moms and grandparents, and I love having grandparents in. They're a lot of fun.
They
and
are.
They really enjoy seeing the baby get checked out. So and every now and then they may give a piece of bad advice, and most of the time I say, for the most part, just talk about it later.
Yeah.
Ask me about it. Hey, somebody's saying do this. Should I really do it? And we'll let you know if it's a okay thing
I like
to do.
that.
So
that's a great idea.
But respect them otherwise.
This has been so much fun. I feel like I could ask you like 2 more hours worth of questions, but I want to respect your time, and I want to. We do something called fun favorite things, and so we're going to start our favorite things segment, which means we're getting close to the end of the podcast, but also we get to learn about you more personally. So that's always fun. So first of all, favorite thing, I want to know your favorite restaurant in West Texas.
Ooh, favorite restaurant in West Texas. That's a good question. It's going to be a little lame, but probably mine, and then my kids would probably be Texas Roadhouse.
Oh, that's not lame. The bread is so good.
Oh, it's so good. Yeah,
so good.
It hardly ever goes wrong. Like,
right.
The food's always good, and the steaks. I like the steak there, and you go to all these places and get these, fancy steaks, and sometimes they're just not even as good. So I like Texas Roadhouse. My kids love it, so we go there a lot. So.
Awesome. Okay, favorite coffee shop.
I'm not a coffee drinker.
Okay.
So I can't really give you a good coffee shop.
Wait, is coffee bad for us? Are you going to tell us coffee's bad for us, doctor?
No, because
they'll
tell you it's bad for you, and then
they'll change it later. Yeah.
Okay. So if you like coffee,
you just don't like it. You just don't drink coffee.
I just don't. Yeah, I kind of find it bitter, and it's just not my favorite thing.
Gotcha.
So,
okay.
Yeah.
Favorite book you've ever read?
Favorite book? That's a good question. I kind of like fiction stuff. So and I like either apocalyptic stuff or kind of government control things. So I like 1984 and those kind of books where it's kind of more, the government's taken over.
Conspiracy theory.
Yeah. I like that kind of stuff.
That's awesome. Awesome. Favorite movie?
Oh, favorite movie. Okay, my favorite movie, and that's going to go back to the other thing, is The Matrix. So have you ever seen The Matrix?
Yes.
Okay.
Yes.
So favorite movie of all time, both in kind of cinematography, just kind of how it
it's
changed
cool.
changed everything, and the story of it. I just love it. So
And there's like Matrix 1, 2, 3. I don't know what number we're on now, right?
yes, there's 4.
We're on 4. Okay.
First one's the absolute best. It's a masterpiece.
They always are, right? The
Yeah.
first, the original are always the best.
Yes. 2 and 3 are okay. I like them just because of growing up with them. I thought they were okay, but they're not great. The 4th one was pretty bad, but we won't talk about that. So,
Okay,
yeah.
okay. Favorite song? You're walking in to work on a Monday morning. What's playing in there to get you pumped up?
You know, I go through, I'm all over the place. I mean, I grew up in, the 2000s, so my heart is in that kind of early 2000s kind of music. So I like that stuff, kind of that pop music.
Yeah.
But that's usually not what I'm playing. In my office, I play Forrest Frank. It's just a good
Oh,
vibe.
yes.
So Forrest Frank's a good vibe for the
Yes.
office, so that's what I play in there. So
Nice.
Yeah.
I like it. Okay, favorite fun fact about you we would not know by reading your bio.
Okay, by reading my bio. I mean, I'm a pretty simple person. I do like to do a little bit more exciting things sometimes. So I've been skydiving, and I would like to go again, but I can't until all the kids are grown. So I can't do that. Risk my life at all.
I get that. Like
Yeah.
we haven't traveled to. We want to go do a European tour across across the world, but
Yeah.
we're like, well, we can't do that till the kids are all raised and out of the house.
Right, yeah.
Like, then we're down to one more. So no, I get that. Like you can't risk the skydiving until they're grown.
Yeah, exactly.
Yes.
So,
But you're gonna do it again, right? That's on your list.
yes, if I could have hobbies that I had unlimited time and resources, I'd probably do a lot of skydiving.
Okay.
And I'd learn to scuba dive, and I've done some scuba diving, but I would do that.
What does it
a
feel
lot,
like
so.
when you're jumping out of that plane? Because I've never done
Oh,
it.
you've never done it?
No.
It's great. It's not super scary because you're just falling
not.
for so long.
Okay.
I've never been bungee jumping, so that's different. I mean,
Okay,
you can
yeah.
see the ground.
Yes.
But skydiving, you've got a long ways to go and to think about it. So mostly, I just like the free wind in my
Just that
face.
feeling.
And, yeah, just the
I've heard
feeling
it's
of
amazing.
that initial jump. So
Okay.
yeah, it's a lot of fun.
Very cool. Okay, favorite life hack, something that makes your life a little easier.
Something that makes life easier. I don't know if I have anything in particular other than I used to be a lot more of a worrier and worrying about every little thing in my life, and everything's supposed to go a certain way. And I think as I've gotten older, I mean, and this is mostly for younger people out there and adolescents.
Yes.
Try not to do that. There's many things and ways that life's going to work out, and so I just try to kind of go with the flow and try to make life easier that way, and not just panic about every situation, and just try
Yes.
to let things come to me. So
Have a go with the flow attitude.
yes,
I like it.
So
I
try.
like it. I know. I think that's fantastic. Okay, favorite piece of advice you've ever been given?
Favorite piece of advice? Don't make any tough decisions during the wintertime.
Oh,
That's in pediatrics, though.
I like it.
In pediatrics,
It's a good. I think it's a good general rule.
I think so. In pediatrics, we have seasons. So in
Uh-huh.
the summertime, it's not as busy,
Yeah.
and you see well checks and everything's okay. And then in the wintertime, it's the roof's falling in and everybody's
Yes.
sick. And so I learned this in residency. So don't make any big life choices during the wintertime because you're so busy. So whatever season of life you're in, that's the busiest and hardest. And don't make huge decisions at that time. Wait till it calms down. So,
Yeah, that's good
yeah.
advice.
Yeah.
Yeah, not just for pediatricians. I think that's good. That's good life advice.
Yeah.
So, speaking of, what's your favorite piece of advice to give to someone that is wanting to be a doctor or be a pediatrician, go down the path that you have gone that you wish you would have known?
Okay, so with the advent of AI, I would say be careful if you want to be a radiologist. It doesn't seem like that's going to be around very long.
You're the second person to say that.
Really?
In the medical field.
Yeah.
Yes. Someone else just said the same thing because AI is just reading it.
Yeah, I think there are certain
That's-
fields that will be okay, but
Okay.
I think I talked to a medical student one time, and they didn't want to do radiology, but I said, I'm worried about that field.
Yeah.
I think there will be fewer, which, I don't think I knew any radiologists in my my grade, so
But that's good
who knows?
advice. If you are considering the medical field, maybe check out some other
Yeah.
some other routes.
Other routes,
Other
yeah.
routes to be in medicine besides that because
Exactly.
of AI. Yes.
Yeah, and it's going to be a long time, so your training is going to take a long time, and you're going to go through a lot to get there. And then when you get out, now that I'm doing DPC, you can do whatever you want, but if you don't have a passion for something in particular, like some kind of specialty, and you want to, be a family medicine doctor or an internist or a pediatrician, where we do kind of general medicine and all things. Although the outlook looks a little bleak right now, and as far as medicine goes, there's options like this, and so now maybe this may make somebody who thought, well, I don't know if I want to be a family medicine doctor or a pediatrician because of how they're worked, and they're kind of the least the insurance companies worry. They don't really care about them too much. There's another
Which
option.
is crazy to me. I mean, that
Yeah.
that would be the least of their worries because it's children and it's families and yes. No, I love that. That is great advice.
So
Great-
hopefully more people will be like, hey, maybe I can go into pediatrics and do this model and lead a fulfilling life, and and so that's the hope.
I love that. Okay, and final question, second to final question. Okay. I feel like I say this a lot, but favorite parenting tip that you like to give to parents?
I'd like to give parenting tips. I'm not super great at it just because I feel I don't like to be, saying things that I don't follow myself, and it's hard to follow all the advice that a pediatrician will give you. So
It is hard, and it's hard because you're in a place where people are asking for advice. As I heard a great quote the other day, and it was from this book I was reading, and it said, wait, I wrote it down. Hold on. Hold on a second. I have to make sure I get it right. But it said, where are you? The difference between a pest and a guest is an invitation. And I was like, that is so, and they were talking about giving advice.
Yeah.
But it's like, but you actually have
People
people
ask,
coming.
advice.
So you're not there, you're not being a pest when you give advice.
That's true.
You're being a guest
Yeah.
when you give that advice. I just thought that was a great quote. Thought I'd share it with you. But
I usually
so if they are what is that one? Because I think a lot of people do look to their pediatricians like, oh, help me. What is it?
Yeah, it's hard for me to tell you how to parent. Everybody's so different on how they discipline their kids and how they lead their life. I don't know what their life is like at home. So the main thing is just know that your kid is different from every other kid out there, and so try not to compare them too much to other kids and to their siblings, and know that even if they're not in these certain areas and where you want them to be, whether it's how they're growing or how they're developing over time, we watch those things and make sure there's not something wrong with them. But as long as they're falling within a normal range, everybody's going to find their strengths in time, and they'll get there. So try not to put a whole lot of pressure on them. So
good advice. I love that. Good parenting tip. Okay, we've come to the end of the podcast, and this has been so much fun. I've loved getting to know you and what you're doing and how you're helping our community, because we really we were in a time there where I remember hearing in the community, every pediatrician practice is closed.
Yeah, it's full.
What am I going to do? And so I'm so grateful that you are choosing to return to West Texas, because that's what we want. We want good West Texans to go out, get your education, but come back and share your gifts here, and you're doing that. So thank you for doing that. Is there anything in conclusion that we haven't talked about that you really wanted to talk about before we say goodbye that you want to say to all of our friends and listeners out there in YouTube or Apple or Google Play or Spotify land?
Yeah. Not necessarily, just that I thank everybody that's chosen me to be their pediatrician over the years, and people that are now choosing to come to Nest Pediatrics, and just know that every doctor out there, 98%, 99% of us do care, and we want to do what's best for you. Sometimes we are limited by the office that we're in, by the limits of insurance companies or hospital systems that we're in. But we all do care, and we want to help you as best we can. And hopefully more doctors will look into this model of DPC, and patients will find out about it and realize that it's a really good model.
It is, absolutely. Well, thank you so much, and I appreciate your time today and all the fun tips you shared, and fever talk and all the things. It was really informative. And I encourage you, if you are looking for a pediatrician, you really need to see if this is the best option for you, because as you just saw today, Dr. Robbins knows what he's talking about. And he gave some great information, and you can tell your heart behind what you do. So thank you so much for being here.
Yes, thanks for having me.
I want to thank all of you for listening. Please share this with someone that you love, someone in our community. We want to keep the good news going of West Texans, and we do. We have so many good things happening here in West Texas. That's what I love about this podcast, is we get to share the good stories of West Texans and what they're doing to make our community better. And so thank you for your time listening. Thank our sponsors, Rig ID Workwear, Midland Cap Company, Omni Midland Hotel, The Preserve at Midland, Then FR, and JoinCapClub.com, and Laughlin Hotel. And we appreciate you supporting local wherever you're at. Of course, you know my heart for you. I want all your dreams to come true and for you to live your best life. So don't forget to dream big, believe, and never give up. You make it a great day.